Hi everyone, my name is Chloe and I wanted to just take some time to explain all of my symptoms that I feel are related to my diagnosis of Charcot-Marie tooth disease. I have type 2Z specifically, and that was confirmed through genetic testing, and obviously I've had plenty of physical exams to kind of confirm this as well as hereditary in my family as well. So I wanted to just kind of briefly explain that I'm obviously not a doctor, and some of these symptoms might not be related to CMT at all, but I just want to get it out there in case, down the road, this is something that is inevitably paired with type 2Z. So without further ado, let's talk about my eyeballs. So I actually have Horner syndrome, where one eye is actually smaller and different like size and shape than the other one. Typically people get Horner syndrome from like a blocked artery or any type of like severe damage, but there is a very rare chance that you could be born with Horner syndrome, which testing showed that I definitely was born with it because it is caused from me having a left dominant carotid artery in my neck and also my brain. So I am left heart dominant, meaning it gets the supply mostly through the left side. This increases my likelihood of getting an aneurysm anywhere, mostly like under my clavicles. Very, very high chance of that, but luckily I don't have any blockages, especially right now, but it's something to look for in the future. But like I said, I was born with this. Obviously, you can't change how your arteries are dominant as you grow up. I obviously have had this smaller eye, and it's been since my birth pictures. It's not like I've had an injury or anything. So starting with my eyes, I've got one smaller than the other one. It's pretty straightforward. Inside my eyes, as you can see, I'm wearing glasses. I have pretty terrible vision, and I eventually saw a really great eye doctor, and he explained to me, like, I really think you have some type of neurological disorder because you have eye muscle palsy. So my muscles in my eyes are actually like deteriorating, not my eyeballs, but back behind. They're actually deteriorating, similar to tendinopathy, but of your eye muscles. So this is causing me to have less and less vision, that I keep getting my glasses bumped up. I also have prisms in my glasses to pull my eyeballs together since my pupils do not match. So that's interesting. But other than that, my eyes are okay. I do have like some, just like they always kind of burn or are tired, despite having blue light protection in my glasses and me not wearing contacts, obviously. So those are just kind of like questions. I have been tested for Sjogren's, but I don't have that. I am able to produce tears. It's just like a little bit drier than normal. So beyond that, I've also found out through imaging that I have a Thornwalt cyst in my brain. It's a very, very tiny, benign tumor, very tiny, that causes a lot of headaches. It causes eye pain, some sinus issues, and potentially like hearing issues. So that was pretty interesting. Other than that, there's really nothing to do about it, I guess. But moving on, so I'm just gonna kind of go from head to toe. So we've already got my eyeballs. We've got the Thornwalt. I also had a really bad deviated septum when I was younger. Really terrible sinuses even now, and my allergies are ridiculous. They are very bad allergies. I was also born with like a lot of like super crowded teeth, like as I was growing up. I've had them straightened, obviously, and my mouth is very small, which was kind of like Ehlers-Danlos type question in my mind in the past, because I only have 22 teeth because I've had to have so many removed just to make room because it's so small. I often have difficulties with my volume control, like, especially at nighttime for some reason. Instead of talking at a normal level, I'll just get like really loud when I have no idea I'm even getting loud. It's kind of like you just turn up the volume from 10 to like 35 all of a sudden, and it definitely alarms my husband while he's trying to like wind down for bed. But yeah, so pitch, not necessarily pitch, but volume issues. I'm wondering if that's connected at all. And then bone wise, I've had bone scans, I've had x-rays, I've had MRIs. Basically, I don't have arthritis, which is weird considering all of the pain that I'm in. And my chiropractor inevitably says it's not your bones that the problem is coming from, it's your muscles, because some muscles are way too strong to compensate for the weaker muscles. So I'm learning that that is a huge CMT related issue where our bigger muscles have to compensate for the weaker ones, and that causes us significant pain and tension, and then also muscle deformities because of it. So I would say like my muscles are I'm actually very strong, but my muscles are not distributed normally, and that's what causes things to slip out, and a lot of pain and discomfort. So my neck needs adjusted all the time. I could always use a neck adjustment because my neck is just not on properly because of my muscles holding it down. In my shoulders, I have really bad upper and lower cross syndrome in my back. My right shoulder, like where my shoulder blade is, I have really bad shoulder knots, which I'm going to get another round of injections in soon, which they have helped me. I know a lot of people, they don't last very long, but mine lasted about maybe like 5 months before it started getting bad to where I'm now like, okay, let me get some more. So on top of that, I definitely have like the triangle shoulders, which is definitely not normal for women especially, but you can tell like there's muscle there. So this is completely correlated to my upper cross and me like having to hold my body up different than other people. And in my back, I obviously have scoliosis. So scoliosis is one of like a pretty definite thing for type 2Z. So scoliosis is pretty significant for me. And this obviously throws my hips out weird, and that makes the muscles more difficult for me to kind of keep in track, because they're always slipping and my hips are torquing like this. It's usually almost always my right hip goes up and my left one goes back. So that's my typical little hop-along that I do, that the chiropractor luckily helps me with. And as far as that, so we've got neck, shoulders, shoulder blade, lower back, hips, my knees, they also tend to go out. They crunch a lot, they dislocate sometimes. The tibia, not the fibula, but usually the big one tends to go out, which is not fun. And my ankles, they're always achy and stiff. And I want to talk about my wrists and forearms. So my understanding is obviously like the longer the nerves, so your feet and your hands, the more likely to have neuropathy in them is for this disease. So it makes a lot of sense. I've always thought like I had carpal tunnel and tendinitis in my wrists. I've also been told from a doctor I've got de Quervains in my like thumb wrist area here. I always thought that was from overuse, although I never really really overused them. It was just kind of like normal usage, I felt. But I would definitely explain like severe achiness in my wrists, and sometimes like me holding things. Like I said, I'm very strong, especially for my age and being a woman. But I'm very strong, but yet anytime like I'm holding something using my wrists, like a milk jug, water, especially anything bulky, that really, really weakens my wrists. And sometimes I just drop it because it's just too much. So yeah, a lot of pain. I wear a lot of like wrist wraps and all that good stuff. I do have a little bit of neuropathy in all of my fingertips. I would say at least 4 out of 7 days a week, I can significantly feel it where it drives me insane. Sometimes, you know, my neck makes that worse. Obviously, that's a pretty common experience, but, you know, sometimes it's just because. So for me, it doesn't go past like the first joint, so that's good. Although like my thumbs, I can kind of feel it go down a little bit. But like I said, it's not anywhere to the point where I can't control them, and I'm very grateful for that. And as for my feet, I do have the high arches. They're not nearly as significant as type 1 for Charcot or Charcot Marie tooth. So like I said, I've got high arches. My toes tend to up curl instead of like, it's weird. So my toes themselves go up, but they're claw-like. So the toes arch like this, but they're turned upwards a little bit, and I will show you guys. So that's interesting. But as far as neuropathy in my feet, my last 2 toes and then like the side, the outer side of my foot, and sometimes my heels is where I feel it the most. So definitely it's very distinct. It's these last 2 toes, especially the pinky, and my ankles. I feel like sometimes I think I have neuropathy in my ankles, but clearly it's not as significant as as normal people would have it, because it would start fully in your foot and move its way up. So again, I'm just kind of sharing what's going on with me externally right now. But internally, I wanted to let you guys know some organ issues that I've had. I have really terrible acid reflux, like, I mean bad. I've got it now and it's midday, without having hardly anything acidic. I had toast and I had a little bit of milk, so that's interesting. But really bad acid reflux, and this is in all of my father's side of his family, which are probably not the side that has CMT, so this could be different. So just putting that out there. My lungs, I've got really bad like costochondritis, so I need to definitely like open up my rib cage, and back issues for me to breathe properly. I get pleurisy, I have asthma sometimes. My acid reflux causes the asthma, so that's of course, so that's an issue. I'm 25 and I've already had my gallbladder removed. It was labeled like chronic cholestasis, where the gallbladder itself was so thick and inflamed. There were so many stones, and I also had polyps in there, which was surprising. So I've had that out. Unfortunately, inflammation-wise, nothing really changed. So we'll just kind of see how that goes. But yeah, acid reflux for sure. Gallbladder has been removed, and then my heart and lungs. So there's kind of like a lot of moving parts here. And also for those of you who menstruate, my menstrual is much longer than most people. So the typical menstrual cycle is 28 days. If I am not on birth control, my natural cycle is about 35 days long, which is kind of strange, but it's still in the realm of normal. And it's extreme bleeding. I mean, extreme bleeding. And pretty significant cramps, nausea, all the extra symptoms. It definitely makes my whole body pain a lot worse. I am intentionally off of birth control right now, so in another month I can get tested for PCOS with all of my hormones, because you have to be off of everything essentially to really know what's going on. So that is something that I will have more insight on later, but I wanted to just kind of bring all of this together. And before I go, I want to share with you what my leg and feet situation looks like. So follow me. Okay. As you can see in this mirror slightly, there we go. Okay, so as you might be able to tell, I have slightly high arches, like I've said, definitely more significant than a normal person, but definitely nowhere as near as type 1 of CMT. And then also my knees have an issue with going in together, and I cannot put my feet together unless I bend down like so. So if I want to, I have to really buckle my knees, and it does not feel great. So this is how my legs typically are when standing, because they go out. And again, I've got some high arches where my feet definitely upturn. So that is it, and I hope this, at least brings some normalcy or confirmation to some other people with this type. Please share your journey so that other people can feel like, there are other people out here with the same type. Feel free to comment. I'll be happy to respond. Bye. So unfortunately, there are a lot of symptoms with this type, and I wanted to go over a couple extras that I have forgotten in the video as I am looking back. So one, I wanted to explain that I have really freezing feet, especially at nighttime, to the point where they hurt so bad, but they putting them on somebody else, it is so cold that it actually hurts the other person. So it's not just an internal sensation that I'm feeling, it's real cold. And this happens no matter what, winter, summer, spring, fall, they are freezing. I wear super, super thick socks to help with that. Unfortunately, compression socks hurt me more than they should. So compression socks are not the answer for me, but warm socks definitely help. Additionally, I have extensor hallucis tendinopathy in my ankles, where they definitely hang weird. And another thing is I have one of the rarer symptoms, but I do have a neurogenic bladder. I don't have incontinence, but it's definitely just not normal. It doesn't empty all the way sometimes. and there's a lot of urgency. So again, these are just some extra symptoms that I forgot to throw in there. Thanks.